Hello, everyone. It's Tuesday, July the 20th. The last day I was with you and everything. I'm sorry, it's Thursday, July the 20th. But nevertheless, good gracious. Let's start this thing over. It's Thursday, July 22nd. But anyway. Before I go into the situation in regard to the number of deaths that we have in West Virginia and the heartache and everything that families are going through, I want to say something on that's really a pleasant thing. I truly believe that West Virginia should be so proud of themselves in every way, all the time. It only perpetuates goodness, around our nation and the world. But if you haven't come down to the Capitol and walked through the grounds of the Capitol in the last, while in your life, now's the time to come. Absolutely, our grounds people are doing an incredible job, but the flowers are spectacular, and the Capitol is really showing West Virginia off, and that's really great. There's people that come all the time. They walk through and they see just what West Virginia truly is in so many different ways all over the place. But our Capitol is beautiful beyond belief, and our grounds people and the job they're doing, it couldn't be more beautiful. And so come down and see the flowers showing off and the Capitol showing off and West Virginia showing off just how great we really are. But the other thing is we've got some reconciliations, that we're doing, that have to be done. And as we get these in, we always try to recognize these great folks and everything that we've lost. We've got a total today, I think, of 12 that have just made it through the system and everything. And so we've got to clean up 12 prior deaths that we've lost in West Virginia. We've lost 3 additional people since the last time we were together on Tuesday. I'm sorry, that's 11 additional deaths that we have got to reconcile now. So I'm going to do the folks, the 3 that we've lost since last Tuesday first, and then pick up the other folks. But again, I ask for your prayers for them. We still continue to trend in a great way. I hope and pray soon this will be 0 and 0 and 0. But we've really lost 3 since last Tuesday, and we've got some reconciliations that we've got to do here. So nevertheless, our 2,920th death is a 38-year-old male from Fayette County. And our 2,921st death is a 41-year-old male from Hancock County. Our 2,922nd death is a 69-year-old male from Berkeley County. Now for the reconciliations, the ones that have just gotten to us and everything. But the 2,923rd death is a 76-year-old male from Fayette County. Our 2,924th death is a 97-year-old male from Lincoln County. Our 2,925th death is a 63-year-old male from Wood County. Our 2,926th death is an 88-year-old male from Jackson County. Our 2,927th death is an 80-year-old male from McDowell County. Our 2,928th death is a 76-year-old female from Raleigh County. Our 2,929th death is a 69-year-old male from Marion County. Our 2,930th death is a 78-year-old male from Berkeley County. Our 2,931st death is an 87-year-old female from Nicholas County. Our 2,932nd death is an 81-year-old female from Monongalia County. And our 2,933rd death is an 85-year-old male from Berkeley County. Now, we've got 2 or 3 things that, that on my notes that I have here are inconsistent with the dashboard. Jordan, I'm showing 2,933 total deaths, but your dashboard number is 2,934.
The DHHR will be updating that.
Okay, all right. Well, nevertheless, I don't want us to make mistakes, but in this, these are just cleanups, and I hate it for these folks, but we get it out as fast as we possibly can. I want to tell you all the time that I want to be completely transparent and truthful with you in every way. We get it out as fast as it can come, as it comes to me. And so in all this, I ask for your prayers, and I ask for your thoughts, and I ask for you to call these people, and absolutely don't ever let them feel like they're alone. And the only other thing that I would add is 2 of the 3 deaths that we've had since last Tuesday are a 38 and a 41-year-old people. And so if we've got 2 folks that are of that age, please, young people, go get vaccinated. Come on, please. We have 126 new positive cases in the last 24 hours. We have a daily positivity rate of 2.61. Our cumulative has inched down just a little bit more. And it's now at 4.94. This is concerning a little bit. Our active cases are up to 1,225. You know, they continue to move up. That's not good. Recovered cases are 161,365. We have 89 people that are hospitalized in West Virginia now, and 38 of them are in the ICU units. We have no red counties, but we do have 1 orange county, 10 yellow counties, and 2 gold counties. You know, you can see that map almost got totally green. It's starting to change. We got to watch what we're doing here. Reminders are, you know, if you're 65 and older and everything, please get a test if you feel the least bit bad. Absolutely the least bit bad. You know, and it goes for all, vaccinated and unvaccinated. But if you're 65 and older and you're not vaccinated, you're in a mighty, mighty, mighty small minority of folks. Almost 90% of our 65 and older are vaccinated now. And we absolutely need to continue to push that, because those are the folks that are the most vulnerable. Remember the antibodies. If you can get a test early and we can catch this early, these antibodies will stop it. As far as vaccine eligibility, 12 and older, as far as getting your second shots, you've got to get your second shots. You know, as far as the effectiveness of the vaccines, they're off the chart good. Young people, we need more and more and more of you to get vaccinated. I mean, school's getting ready to start. So many opportunities that are coming in your life and everything. You need to be vaccinated. That's all there is to it. If you're vaccinated and by chance you would contact this terrible disease, you would not be able to get it. You would not be spreading it to others. Absolutely, that's a big plus. You would not be having to worry about yourself and all the problems that it could cause you. I mean, there's so many potential side effects and everything. Help us with our young people, and that's parents and grandparents, to get them vaccinated, please. Our COVID vaccine info line is up there always. Our Delta variant numbers are beginning to jump a little bit. I'm still not super concerned by this and everything, but it is something from a nation's standpoint that we should be super concerned about. Our Delta cases have jumped to 35 from 22, and if you just looked at that on a percentage basis, you'd say, oh my gosh, oh no. You know, this thing is, we've jumped 50% in cases. Well, we have jumped 50%. But in that, really and truly, we're only still at 35. But we all know, if you'll just listen to the health experts, and I'm not a doctor, but just listen to them, they'll tell you over and over, this thing's coming. This thing's coming, West Virginia. You know, one of the Trump leading officials, health officials, told everybody the other day that if you aren't vaccinated, you're going to get this Delta virus. And if you get this Delta variant to this COVID virus and everything, it's going to be tough on you. It's going to be really tough. And it may end really, really bad. And so you've got to get vaccinated. Now, And so all I would say is this Delta thing is coming, and the more of us that are vaccinated, it absolutely moves us into a position to where really and truly we can stop this dreaded killer. You know, this whole thing takes a chain that if one person gets it and the next link in the chain, that person's not vaccinated, they're going to get it. And the next link in the chain, if that person's not vaccinated, they're going to get it. But if the next link in the chain is a person that's vaccinated, and then there's unvaccinated people on the other side, the likelihood of it skipping across is not good. So the net of the whole thing is the more people that are vaccinated, the better the strength of the chain is from the standpoint that it can't move because there's links out of the chain all over the place. Now, the other thing is we all know this. I don't know why in the world we can't get this, but we all are respectful to those that have decided, no, I'm not getting the vaccine. But at the same time, we all know that the more people are vaccinated, the less people will die. We know that. Just ask yourself how you would feel. How would you feel about this? How would you feel about, you know, whatever the situation may be, but you've got a loved one that just, because of all kinds of problems and everything, they can't take the vaccine. And you're worried to death about them. And all around you, there's your friends or your neighbors or whatever like that, and they're saying, no, I'm not getting vaccinated, no way, no way. And then all of a sudden what happens is a couple of your friends, neighbors, whatever like that, become infected. And sure enough, they bring it, not intentionally by any stretch of the imagination, but they bring it right to your house. And the very loved one that you're talking about, that you're really worried about, is now in the ICU unit. How do you feel? You surely can't feel good. We got to get vaccinated, people. That's all there is to it. Yesterday we went on the road. We've been doing it every Wednesday and do it for Baby Dog sweepstakes. There's 362,000 West Virginians now registered, and those are the people that are in the drawing. If you're not registered and you have been vaccinated, all you've got to do is just go on and in a minute get registered, and who knows, your name may very well be drawn. The lottery's doing a great job with this and everything, and they pass it all down to us, and then we go with it every week. You know, yesterday we started off in Charleston with a beautiful lady and everything, and her name Hope 2 and everything. She won a giant, one of the giant trucks, and there she is right there and everything. And these are $80,000 plus trucks and everything. It is a great lady, and what a testimony. You know, what a testimony that she talked about people getting vaccinated around her and her family, and she, you know, just a beautiful lady. That's all there is to it. So we started off with a bang right here in Charleston, and we gave that truck away, and then off we go. You know, off we went to Morgantown and then on to Fairmont, and we walked into the Ruby Hospital. We knew that that lady right there, her name is Denise Morrison, and Denise won the $1 million prize. In the room, there was probably, I don't know, 100 folks that were mostly nurses and people, you know, that had been working. You know, a lot of them had surgical gowns on and everything, as you can see right there. And all of a sudden, you know, I walked in the room with Baby Dog and said, Baby Dog and I are looking for Denise Morrison. Does anybody know where the newest millionaire in the state of West Virginia is? And what a beautiful lady. I mean, absolutely. I think she's a surgical nurse, and what an incredible job she does. That room exploded. It exploded in cheers and tears and everything from the standpoint of how much those people support and love this lady. You know, it is really great. It may have been the very best one. If it's not the best one, it's very close to the best one we've done so far. And what an incredible job all those people in that room have done. I just can't tell you how much I love them and how much and just how much we appreciate them. All those people, especially, those are the people that walked right into the fire and absolutely saved so many lives. And so, what an incredible hospital. Dr. Marsh was there, an incredible job that he's done over and over and over and everything. And but Ruby is a special place. And you know, my grandson rather, was just there, and what a job they did with him and everything. We were really worried about that and everything, but all that came out good. And so he's getting better and every day. And so it just, it's a testimony to just West Virginia's greatness in every way. But boy, what a fun time. And she's with us today. Denise Morrison's on, and I'm going to let her talk just a second.
Hello.
Hi, Denise.
Good morning. How are you today?
I'm great. I hope you're doing good.
I'm doing great. I just wanted to tell everybody to really go get the vaccine. I was talking about it earlier, and I know some people are hesitant to get it at first because it's new, but being in the healthcare system and seeing how much it affects patients, families, and healthcare workers, is very important to get it. Once you witness what some people go through, I don't understand how you couldn't get it.
Well, Denise, listen, before you go, I got to thank you again. I mean, there's an old saying that a fellow that is an athletic director, was an athletic director, and he told me this one time. He said, kids know if you like them. Well, really and truly, those people, those nurses, all those people in that room, when they exploded in support of you, that's a testimony to how great you are. And I appreciate you, and I appreciate all those and all the healthcare community and everything. And we got to keep on working to get more and more folks vaccinated. But spend your money well. I mean, it's good. It's great. And thank you again for all you do. You're really
Thank you.
Beautiful lady. Thank you, now.
Thank you.
Well, let me end this, this way. That was great, and Denise does great work, and it's so good, so good. But so we gave a truck away here. We went to Morgantown, and we were able to give the $1 million prize to Denise, and then we left there. And we went up right outside of Wheeling at Glendale, or met this lady from Glendale. We caught her in the Cabela's store up there. I mean, what a complex that was. I mean, it's unbelievable. And Shannon Cook won a great big truck there, and her husband just happened to be with her, and just that's them together right there. Just a wonderful couple, and that was really good too. So we're really happy for all that, and we've got. Let me tell you this now. In Little Falling Waters in Berkeley County, and I don't know how big that town is, but I think it's probably 1,900 or whatever people. Maybe, but it's not a very big community at all. This is the second scholarship winner that we have pulled from Falling Waters. So we've got Tyson Bennett that is with us today, and he is one of the winners of the full 4-year scholarship. That includes room and board. It includes everything at any of our state institutions, universities, wherever it may be, and so Tyson, I think you're with us and everything.
I am.
Tell us what's going on.
Well, thank you for the scholarship and helping keep them safe and stuff like that. It's been really good for the state and counties and stuff.
No, Tyson, thank you, son. You know, you
Yeah.
look like an athlete too, but you know, anyway, thank you so much, and
Yes.
Tyson,
You're welcome.
you go do great things, buddy. I mean, I
Yeah, I
know
will.
you will. I know you will. And congratulations again. What's going on with that town up there that y'all just keep winning in that one little town?
A lot of people getting vaccinated, I guess.
I love it. That's a great answer. That's a great
Yeah, it is.
answer. That really is. But no, that's really good. Really good. Well, listen,
Yes.
congratulations again. And
Thank
I've
you.
got Tyson. I got this
Yes.
for you. Yeah,
Yeah.
if you can see me,
Mm-hmm.
I'm going to send you this right here,
Okay.
and it's going to say, "State of West Virginia, do it for Baby Dog." You know who Baby Dog is, don't you?
Yeah, I heard about it.
Okay, and it says, "Save a life, change your life. Greetings, be it known that Tyson Bennett, Falling Waters, West Virginia, is hereby awarded this full 4-year scholarship to be used at any public institution in the great state of West Virginia." And we'll be sending you that, and we'll also be sending you this backpack and everything. It says,
Thank you.
"Do it for Baby Dog." So it'll be on the way, and then we just wish you the best in the future, okay?
Chill. Thank you.
All right, thank you, buddy. We've got another scholarship winner that's with us, and the only reason that I want to spend the time, extra time with these kids is just this: we give away $1 million to somebody, and it's unbelievable. And we keep encouraging over and over and over folks to get vaccinated. And whether it's just one, if we can get one across the board, just one more, or 10 more, 100 more, 1,000 more across and get them vaccinated, those lives are really significant. Really, really, really significant, just like all. But I think Kiara is something's happened, and she's not connected with us and everything. But there's a little girl, Kiara Blankenship, and she is a student. She's from Gilbert in Mingo County. Now that county's been really, really hurting, and that community. With the loss of a lot of coal jobs and everything, and now, thank God, we've got a few of them at least back. And we hope and pray we'll grow that, but we don't want to lose any more. And we work it every day. But Kiara, I hope you can hear me, or I hope you'll get this, but, here's the same proclamation that's coming your way that I just read about Tyson. And it's got you right here. It's got Baby Dog signature there and mine right here. But this is for the full 4-year scholarship to any of our state institutions. And it could be worth, it's worth a lot of money. But more than anything, what it is an opportunity for you to go. An opportunity for you to do greatness for your whole life. So for Tyson and Kiara, congratulations. And like I said, it's great giving away the $1 million, great giving away the trucks. But to me, there's nothing better than this. Nothing better than doing great stuff for our kids. They're our future, and we all surely know that. But anyway, congratulations, Kiara. Okay, just some other things that we can get through pretty quickly is, the 6th lottery drawing will be held next Wednesday. You still got time to register. You still got time to get your shot. We're going to do the 6th, and then the 7th one is like double down, and then we're done. We've pushed it in every way as hard as we possibly can. We're going to continue to try to come up with anything we can come up with that helps educate people more and to get them across the finish line to be able to get them vaccinated. But we'll be doing this thing again next Wednesday, and then the Wednesday after that we'll conclude this, and so please, if you want a chance and an opportunity like this, you've got to get vaccinated and you've got to register. Okay, a vaccine distribution update. We now have vaccinated in the state of West Virginia 1,049,307 people. You know, that's really good and everything. We want to keep on just pouring it on just as hard as we possibly can. We're at 88.9% of all the people that are 65 and older in West Virginia, and we're at 81.8% of all those that are 50 and older in West Virginia. As far as 12 and older in West Virginia, 67.4% now have gotten your first shot. So, you know, I just think if we can just keep after this and everything and keep pushing it just as hard as we can, tell your neighbors, tell your friends, encourage, be respectful, and encourage them to go get vaccinated. It's really, really, really important. You know, again, as far as all the free testing opportunities and the testing can detect this Delta variant and everything, it's something that you should take advantage of. I'll just tell you this, you know, that I can't tell you enough to do this. But yesterday I was at WVU at Ruby and I had, you know, I think this is just a little allergy stuff and everything, but a little bit of congestion and everything, a little cough. Cough is a little unusual for me, and I said, no, I'm not going to mess around with this. And, you know, and so what do? I said, Dr. Marsh, you know, I'm here and everything. Can I get tested right now? And I've been tested several times and everything, but haven't been tested in a good little while, but I've got this little cough and a little bit of congestion and everything, and I think that it's just nothing but maybe a little bit of allergies and everything, but I don't know, do I? And I got tested. Came back negative, but I got tested. You know, I tell you, take advantage of this free testing. Take advantage, especially if you're over 65 years of age, take advantage. And absolutely, again, we thank Walgreens and Frith for all that they've done and all they continue to do. We have 2 outbreaks in our long-term care facilities. We have 5 outbreaks in our churches now in 4 counties. That's Cabell, Marion, McDowell, and Webster County. We have 1 inmate that has COVID in this state and 4 staff cases, and I encourage you over and over and over to give blood. Now, let me tell you this, and I'm going to end with something here in just a second, but we have a West Virginia Olympian, you know, that is in the Tokyo Olympics, and you got to make sure you watch this man and everything. It's Patrick Sunderman, and Patrick is a West Virginia University graduate who was on the rifle team and is a former West Virginia member of the National Guard. He is competing in the small bore 50-meter rifle event, and you know, he's going to be on Saturday night. You should be able to see him at 10:30. I'm sorry, on Sunday night at 10:30 p.m. And Patrick, good luck. You know, you're a superstar beyond belief. We're so proud of you and everything. But everybody watch Patrick at 10:30 on Sunday evening. You know, and everybody, you know, be sending up your prayers and best wishes for him, and that he, I'm sure he'll compete greatly, but you know, always needs a little extra help. We all do. Now, last thing I'm going to end with is this, and this was absolutely, you know, a tremendous, I mean, the best part of the day for me yesterday. You know, last Tuesday, we announced a young kid that's really struggling with cancer and everything, and his name is Logan Fluharty. And I did a proclamation because the folks in Peyton City sent it in, and what they were going to do is they have a group called the Valley Avengers, and you know, and they were going to make Logan you know, a superhero called Laser Logan that day. And so here's a kid that's really had a tough go. And he's 18 years old. He's in high school at Peyton City. And a lot of people love him to death. And what a wonderful young man. And so I read the proclamation here. And the first thing I did is after it was over, I said, listen, if we're going close to where he is and we can get there for this parade and everything, I want to go. And so we did. And you know, all I want to be is a grain of sand. I don't want to be the headline of anything. I just want to be a grain of sand of support and love for the great people of this state. And so when we got there, you know, we joined the parade. We went through the parade, and then after it was all over and everything, you know, we went to this park, a beautiful park, and these great people that are. They call themselves the Ohio Valley Avengers. They had a special ceremony, and they presented Logan with a shirt and a little cape and everything, you know, that Logan is one of our superheroes. I took the proclamation, and instead of us sending it to him, I took it, and that's his mom on his right-hand side, and was able to give it to him there. Just what a really good event that these people in this community, you know, and all of them coming together. You know, if you just think about it, and this is what it's all about. I mean, when it really boils right down to it, we're communities. We're communities all across, and we love one another. And absolutely that community and that bond, that love for one another is what perpetuates us in West Virginia, what's got us through this pandemic, which absolutely helps us every day. And so, you know, the overwhelming support that the Peyton City community, you know, shows and loves, you know, for this young man and this family is terrific and surely ought to be recognized. So to all of you in Peyton City, great work. My goodness, and thank you for letting me just be just a particle, just a pebble. You know, but you know, it's really good day. And again, Logan, we're with you, and we're going to stay right by your side, and we're going to continue to pray that all this is going to work out in a good way. And again, I want to read this, but the Valley Avengers are a charity organization made up of high school students that partners with the Make-A-Wish Foundation to bring hope and joy to kids battling diseases. I mean, come on. How good are we in West Virginia? And the world needs to know it. That's just all there is to it. You know, absolutely, this group of high school kids, this group says their mission is to ensure that nobody fights alone. You know, it just brings big tears to my eyes. I mean, great job, guys. Great job, ladies. It's just, we got wonderful kids, and we got great communities in this great state, and I'm so doggone proud of it, it's unbelievable. But anyway, way to go, everybody. That's all I got.
All right, thank you, Governor. Let's now go to Dr. Clay Marsh, our coronavirus czar.
Good morning, and certainly, as the governor has said, there is so much to celebrate here in West Virginia, from the heroes like Denise to our high school students who look out for one another, to the many people that are heroes every day in what they do. And as we look forward and reflect on where we are today, related to the COVID-19 pandemic, as the governor pointed out in his comments, we now are finding additional cases of the Delta variant. Remember, the Delta variant is the variant of COVID-19 that started in India. And it's of note that a recent study looking at people in India and testing them for antibodies for COVID-19 found that over 2/3 of people that they tested had antibodies for COVID-19. And this really goes back to what Scott Gottlieb, who was the head of the Food and Drug Administration under Donald Trump, said, which is, with the Delta variant, if you have not been vaccinated, you will almost certainly get infected. And this is a piece of evidence that supports the fact that this virus, this Delta variant, is different than the viruses we've seen before related to COVID-19. And as we said, there was a recent study from China that demonstrated that in the respiratory secretions, the airway, and remember, that's how we spread COVID-19, through droplets and aerosols from the airway. There is over 1,000 times more virus in the airway with people infected with the Delta variant than there was with the original virus from Wuhan. And that means that this virus is much more contagious, is able to spread much easier because there's such high concentrations of virus in the droplets. And when we look at the cases in the US, we were over 60,000 new cases yesterday. And as we talked about several days ago, Dr. Walensky from the CDC said that now 83% of all cases of COVID-19 in the United States are from the Delta variant. And we know that that's happened all over the world. Remember, in the United Kingdom, where the Alpha variant started in the UK, the Delta variant that started in India now has completely replaced the Alpha variant as the most prevalent form of COVID-19 that's infecting people. And basically, in the United Kingdom, the Delta variant now is about 100% of the new cases as the cause. So as we look at West Virginia, and as the governor said, we're still relatively early in appreciating the spread of the Delta variant. But based on every other place that we have seen, the Delta variant will take over and be the most common variant in West Virginia real soon. And we're seeing the very first parts of that growth. And if we look around the country, in the last 2 weeks, we've now seen a tripling of the number of new cases of COVID-19. We see that in a camp in Illinois that was not required mask indoors and no vaccination status of the children, that 85 teens and adults got infected. 70% were unvaccinated, but 30% were vaccinated. And it also reinforces the idea that although the vaccines are extremely good, extremely effective, and as we've talked about, that 99.5% of the deaths from COVID-19 in this country today are in people that are not vaccinated. So the vaccines really protect people from serious disease and hospitalization. But I think with this new Delta variant and the very much higher concentrations of virus that are in the droplets, we still have to be really careful, even if we're vaccinated, particularly if we're indoors among mixed groups, and particularly, as the governor said, if we're older or we have other health problems or we take medications because of inflammatory diseases like immunosuppressive medications, or we've had transplants, we should be really careful. And you know, as we've talked about many times, avoiding those areas that would be putting you at risk personally, but also consider, you know, wearing a mask, staying physically distanced, being careful just to aid the protection. And in fact, Tony Fauci came out yesterday and said with the Delta variant, for the Americans who are at risk that way, that's probably a really important idea. And as we've talked about, you know, with school coming up and with many children that still haven't been vaccinated, it's really important for parents and grandparents, for any vaccine eligible child, to choose vaccinations. Because yesterday we saw that a 5-year-old in Georgia died from COVID-19. And reports from Alabama are talking about young people now being in their ICUs, having to be put on ventilators, respirators. And one doctor said that when people are about to get put on the respirator because their lungs are failing, they ask, can I get vaccinated now? And the doctors say it's too late. And we don't want it to be too late for any West Virginian. So now is the time. We know that we're measuring the reproductive value across our whole state, and it's starting to rise. We're seeing the number of new cases rise. So there's really no time to wait. Every West Virginian that hasn't been vaccinated is at great risk with this Delta variant growing. And particularly our children are at risk without being vaccinated. So today is the day, now is the time. And we really, really hope that people can hear what we're saying, not as alarmists and not being critical of anybody, but it's because we care about people here and we want to promote the well-being and the goodness of the state and the state's people during this new, different phase of the pandemic with really a different virus that is much, much more dangerous than any virus we've seen so far. Thank you.
Thank you, Dr. Marsh. Next, we'll go to retired Major General Jim Hoyer, the director of our Joint Interagency Task Force.
Good morning. I would like to highlight a couple of things. Governor Justice has continued to press us to focus on preparing for the fall with our partners at the State Department of Education, as well as our higher education institutions. So we continue to stay engaged with them. In addition, he has tasked us to be prepared for a surge that may come up with the Delta variant or a variant that may follow. So we're staying in constant communication with our hospitals and other organizations to be prepared for that as well. We still work and manage a strong supply of PPE should that be necessary. I'd like to highlight a couple of things that reinforce the governor's point on where we've got to go with vaccinations. If you look at first doses, and we do exceptionally well, individuals in West Virginia going from first to second dose. So that tends not to be an issue for us. But looking at first doses, 65 and older, as the governor pointed out, 88.9%. We are on the way to achieving his objective of 90%. 50 and above, 81.8%, on our way to achieving the objective of 85%. But if you go to the other end of the spectrum, 18 to 29, we are only at 46.9% first dose. And 12 to 17, we are only at 41%. And going into the school year, we need to work cooperatively across West Virginia to make sure that we get those young people who are now more vulnerable to these variants vaccinated. So it asks all West Virginians to work to get educated and to do the best we can to get those numbers where they need to be to protect our fellow citizens. Thank you.
Thank you, sir. Next to Dr. Ayn Amjad, our State Health Officer.
Good morning. As the governor mentioned, 11 of the 14 deaths on our dashboard are part of the Bureau's continuing efforts for data reconciliation and combining our death certificate data. I just want to mention that of those 11 of the 14 deaths, those do compile from December of 2020 through April, May, June, and July. So those do span over several months' time. But if there's any further questions, we'll be happy to answer those also offline. But those do compile, our data reconciliation that we've been trying to reconcile for the last couple of months. Thanks, Jordan.
Thank you. Secretary Bill Crouch with the DHHR is also joining us and is available for questions. We'll now go to questions from members of the media. The first today from Kenny Bass with WCHS and Fox 11.
Hi, thank you for taking my questions. I have two, and I'd really like if both of them could be addressed. I can't decide which one is more important, so I think I'm going to ask both of them. The first one is, when the Delta variant is concerned, statistically, for Dr. Marsh or Dr. Amjad, what is the chance of a breakthrough infection for people whom are fully vaccinated? I keep hearing a lot about people not completely vaccinated and unvaccinated, but for those fully vaccinated, statistically, what are the numbers showing us about Delta variant infection? And secondly, about vaccinations in general, maybe the governor could address this one. There have been so many mixed messages on the COVID pandemic, from masks to the new variants, which keep popping up. Those aren't mixed messages, but it's continuing information. A good example, the American Association of Pediatrics and the CDC are differing on their policy for wearing masks for children in schools. We have states with different mask and gathering guidelines, just an inundation of information that is inconsistent. How much does that contribute to vaccine hesitancy? Because many people have told me that because of the different guidelines, because of the different recommendations, because of the different rules, that they just don't trust or believe what's coming out. So if those two questions could be addressed, I'd appreciate it. Thank you very much.
Let me go first, and let me do Kenny's second question. I'm just trying to think how to put this in just plain everyday talk, because I can't hardly do it any other way. Let's just think about this. Kenny's question, I guess, centers around, there's a lot of differing opinions on different issues, whether it be CDC or Dr. Fauci or whomever it may be, on different things. And I wish like crazy we just had really good, solid information on everything. You do this is going to happen. You do this is going to happen. Well, we all wish that, don't we? And we all know too that there's some even impact that shouldn't be there at all. That there's some political, influence in this too. Well, that should never be there. And the inconsistency, though, is just this: like it or not like it, nobody that you see, nobody that's around you, nobody has ever been through anything like this before. And really and truly, we continue to have to adjust, do we not? But the reality of the whole thing is just one thing in regard to the vaccines. And again, I'm super respectful. But at the bottom line to the whole thing is just one thing. Nobody can dispute that these vaccines are, for the most part, as harmless as they could possibly have ever been. And they are highly effective. And absolutely, can anybody dispute the fact that the more that are vaccinated, the less are going to die? So the bottom line is just this. We all wish that the information coming out of DC or the CDC or whomever it may be would have been just right on the money. How can it be? How can it possibly be? Nobody's ever been through this before. Nobody has a playbook. It can't be. There's no way. So we continue to have to adjust, do we not? That's all there is to it. And absolutely, as we go forward, like it or not like it, the bottom line in the adjusting is one thing, and it has never changed. If you're vaccinated, the likelihood of you having a gazillion times better life are greater. From the standpoint of less people dying, it is absolutely the thing to do. Now, I got to say just this too, because I'm really stuck on this. Dr. Clay Marsh is a superstar beyond belief. And Dr. Clay Marsh is a smart cookie. Now, when it really boils down to it, when Dr. Clay Marsh is sitting there telling you about your kids, about yourself, and he's telling you that absolutely if you would end up lying in an ICU unit or whatever and say, can I get vaccinated now? Is it too late? And what did he say? Doctors are looking at people saying, it's too late. It's too late. We know we're going to go back to school real soon, don't we? Absolutely. Your kids are going to go back to school real soon. We know this Delta variant is really out there. We don't know how fast it's coming to West Virginia, but Dr. Marsh is who I've got to depend on. I'm not a doctor. Dr. Marsh is a superstar. And Dr. Marsh, you can tell it by his voice. Yesterday when I saw him, he said, I got to talk to you really, really importantly about this and everything. And he was worried. And you can tell it by looking at his face, he's worried. And he's telling you, absolutely, today is when you've got to move. You can't wait till it's too late. And that voice comes and says, it's too late. You can't do that. We know we're going back to school. We know the exposure is going to multiply many times. We know that we want to be able to go to a WVU or a Marshall or whomever football game. We want to be able to go to the West Virginia State, or I'm sorry, the Bluefield State football game. We want to do that. It's the first year they've had football forever. They're bringing football back to that great school in Bluefield. And the first games in the first days of September. I promised them that I'd be there. We want to do that, don't we? We want to celebrate the goodness and the excitement of a WVU game or a Marshall game. We want to do that, don't we? And we've got exactly the ticket to be able to do all that. That's we got to get vaccinated. We got to get vaccinated to where we're not having a meltdown all around us. We know we're going to go back to school. We hope and pray we're going to be able to go to the football games. We got to get vaccinated. Dr. Marsh, not Jim Justice, Dr. Marsh, the medical expert and guru that we could never have selected anybody better. Look at his face. Look at his face when he says, today's the day. Today's the day that you've got to decide to move. You can't wait. That's what Dr. Marsh is saying. And absolutely so nevertheless, Kenny, from the standpoint of your question, you always are really on point. Great question, great question and everything. You know, there's a lot of varying opinions, and I get it. And there's a lot of people that are trying hard and a lot of mistakes that are made. We had to pivot along the way. But absolutely, the bottom line to the whole thing that has never changed, the more that are vaccinated, the less people die. And so we got to absolutely do that. Anyway, Dr. Marsh, y'all can take the other question, please.
Thank you, Governor, and thank you, Kenny. And I appreciate the governor's comments, and I am very worried. I think it's really important that we not see the Delta variant as just kind of what we saw before. Again, this is a different disease. This is much worse, and I don't want to be overly dramatic, but the more I'm learning about this, the more worried I'm getting. The best data right now, Kenny, is probably from Israel as far as reinfection rates. And we'll see what happens in the US, because the US has been affected differently than other countries. And in Israel, they reported about a 64% protection most recently with the Pfizer vaccine and fully vaccinated people. There's been studies from the United Kingdom that said more like 85 to 88%. The Johnson & Johnson protection's about 66%. That's been pretty consistent. I think as we go forward, a lot of the determination about reinfections, though, is not just going to be about how long ago you were vaccinated or who are you. I think a lot of it's going to be on what is your exposure. Because if you think about vaccines as increasing your threshold and ability to fight off new infections, whatever you're vaccinated against, that if you get a normal exposure to an infectious agent, those vaccines may be 100% able to keep you from getting infected. But if that concentration of virus goes up, or your exposure time goes up, or the distance is closer, so you have more of the concentration of the droplets in the aerosols, then even with vaccination, you may not be able to mount enough of a response to keep from getting infected. And right now we're dealing with a virus that is 1,000-fold or more concentrated in the droplets that people produce with it. And also from China, we learned that you start being infectious in 4 days versus 6 days, which we saw before. And we also see now that there's a group of people that are infected and infectious who may not be very symptomatic, like we talked about before. So this is a very unique situation for us. And the concern is we're looking around the country, you're seeing reports of people that are getting breakthrough cases, been fully vaccinated 14 days after, still testing positive. But as the governor said, the important thing is we are not seeing deaths in people who've been fully vaccinated. So that is a really important endpoint. But I think that that understanding is going to continue to grow. Now, the one piece that's problematic is the CDC has decided, as I understand it, and Dr. Amjad can comment on this, not to follow relatively asymptomatic or mildly symptomatic cases with breakthrough, just serious cases. In West Virginia, though, we've been tracking everybody because of the concern of, whether anybody who's vaccinated could spread the virus. And although we know that the vaccines reduce your likelihood of doing that, we're not sure with the Delta variant whether that risk is zero. So I'll turn it over to Dr. Amjad for any comments.
No, you're right about the CDC wanting serious cases. Okay.
All right. Well, thank you, Kenny. Next, we'll go to Charles Young with WV News.
Hi, this is Charles Young with WV News. Governor, I want to know if you could comment on your plans for the future of these briefings. Do you still think it is necessary to do this twice a week, given where we're at? Thank you.
Charles, I'd almost say you tell me. I mean, really and truly, I think it's from the standpoint of being able to get the word out all across our state, it's an important tool. I'd love it to be able to say, well, we just don't need it anymore. It's surely not something that I would classify as fun from the standpoint of coming in front of you and reading all these deaths and everything. But at the same time, I do believe that it is tremendously beneficial and valuable to all of our citizens, and that's what I'm here to do. I'm basically just here to do just that. I've got one other thing I'd like to say. I was going to end up, with this because I just, I make these notes as we go along. But Charles, I want to tell everybody this, and I want to challenge again. I challenge our media and challenge people all the time. You find something that I've ever done, I've ever told you that's not the truth. Now, I'll make mistakes, but I'll always stand by just that. Most politicians, that's an impossible statement for them to make because the media comes up with something all the time. In a lot of situations, thousands of things that they've basically not told the truth about. But, and they say, well, that's just politics. Well, bull's not. That's not just politics. That's not telling the truth. That's all there is to it. And but I challenge you. I always challenge you with that. I also challenge you with just this. Along the way, these great experts, the General Hoyer and Clay Marsh and Dr. Amjad, myself, Bill Crouch, all the different people that you see, every other day or every day, that are here in front of you, no matter how often we had the briefings. When did we ever tell you something where we were just crying wolf? When did we ever cry something that really didn't happen? Now we had to pivot, we had to adjust and everything. But for the most part, in a pandemic that nobody had a playbook, nobody really had any idea exactly what to do for sure. We didn't cry wolf, did we? And now, right this minute, like it or not like it again, you've got people that are, think about it, Dr. Clay Marsh. What if I were to say in the state of West Virginia, what is Dr. Clay Marsh's approval rating? What if I would say General Jim Hoyer? What is General Jim Hoyer's approval rating? It'd be off the chart, wouldn't it? Probably, really and truly, the only people that could possibly even halfway compete would maybe not just necessarily people, but maybe the person, the buddy that could possibly compete would be Baby Dog. Other than that, their approval rating would surpass probably everybody. Now, if that be the case, you got to listen to them. I mean, how in the world could we be so happy with what they've told us and then not listen to them? Now, I don't get that. And they're telling you today is the day that you got to be making decisions about getting vaccinated, because schools are coming, and we've got 41% of the 12 to 17-year-olds vaccinated, and 46% of the 18 to 29-year-olds vaccinated. Schools are coming. Those football games are coming. And to just say, well, I'm just not going to get vaccinated because I'm just not doing it. You know, that's your right. And I'm going to be respectful of your right. We'll make really, really the wrong decisions. So listen to them. That's all I can say.
All right, thanks, Charles. Next to Mark Curtis with Nexstar Media.
Governor and staff and cabinet members, good afternoon, fellow members of the press. If I could just weigh in on the question that Charles had, I would hope we would continue until further notice with 2 press briefings a week. I think the number of overall active cases has gone up in 2 days by 350 plus. We've got a 60% increase in the Delta variant cases. I think we, and by our extension, the public needs to know as these things change rather dramatically. So I vote in favor, if we're even voting on this, that we keep at least 2 briefings a week. And if it gets worse, maybe more. Now to my question, given the increases I just talked about, the sharp increase in active cases, the 60% increase in Delta variant cases, I know it's only at 35, but that's quite a jump in just 2 days. What are you thinking in terms of a mask mandate? I would imagine there'd be a lot of public resistance to a mandate, but what do you say to people and what is the guidance you have? And I'd like to hear from the doctors on this as well as the governor. What's the guidance on people urging people to voluntarily use their masks again?
Well, Mark, first of all, let me just say this, that Mark, if I need to be here in front of you and I need to have a briefing twice a day, I'll be here. That's all there is to it. Because, and right now, with what is at play, for anybody to say that we really don't need to have a briefing, maybe we can cut back to 1 day a week, or maybe we can do it every other week, they're wrong. They're absolutely wrong. I'm going to be here. And I'm going to be right in front of you, and I'm going to tell you everything that I know every day that I'm here. Now, so you know, I appreciate your words in regard to that, Mark. And the other thing, from the standpoint of mask, I think it's way premature for us to start this rumor and everything. We're going to have to go back to masks. We're going to do this and everything. We surely don't have a mandate now to do anything, whether it be voluntary or whatever it may be. And so let's just hope and pray that you know, some way, somehow, that the wins, you know, are good wins and not bad wins. And that'll be for another day. But for right now, I'm not on board with the mask, and I hope and pray that I'm not going to have to get on board. But I will tell you this, and you know, and you can bank on this. If the medical experts advise, and in my heart I know that things are really getting tough in West Virginia, no matter what it may be, no matter what, I'm going to try with all in us to protect West Virginians, and no matter what it may be, you know, and that's what we've done. That's what we've done all along. And that's why it's so important. That's why it's just a no-brainer to me. You know, it's so important that we get vaccinated. I mean, we all know. I mean, we all know what our ticket is to stop this thing. And we just got to get vaccinated.
All right, thanks, Mark. Next to Paul Mullen with WCBC.
Good afternoon, Governor. Good afternoon, panel. Governor, first of all, congratulations on getting tested. I know after you coughed the second time on Tuesday, I said the big guy better start taking his own advice, and you did, and good for you. I want to make it a little bit personal. I was in a situation where I needed to be fully vaccinated pretty quickly, so I opted to get the Johnson & Johnson vaccine, and that's what I've been relying on. I heard the 66% number Dr. Marsh referred to. And they are now, I understand, considering booster shots, and nothing has been made official yet. If I would want to go back and get Pfizer or Moderna to increase my protection, would there be a prohibition on that either medically or procedurally? Thank you.
That's way above my pay grade. Dr. Marsh, that's you.
Thank you, Governor, and thank you, Paul. So I think it's important to point out that the protection of getting reinfected, at least as I understand it's about 66% from one dose of the Johnson & Johnson vaccine. But the protection against getting hospitalized and dying is still 94%. So that's still a super effective vaccine. The Food and Drug Administration and or the Centers for Disease Control, the CDC, have not come out with any specific guidelines on the requirement or even the recommendation to get a second vaccine after Johnson & Johnson, whether that is another Johnson & Johnson or one of the messenger RNA vaccines, Pfizer or Moderna. There have been studies, though, done in England and the UK that's demonstrated, one, that it's safe to get a second vaccine, even if you mix the vaccines. Number two, that the best antibody levels were, in their study, 2 doses of Pfizer, but the next best level were 1 dose of AstraZeneca, which is an equivalent kind of vaccine, but it's the one that's approved in the United Kingdom as opposed to Johnson & Johnson, then with a second dose of Pfizer. So ultimately, I think that there is some data that it would be safe to do that. It would presumably increase your antibody levels, but right now there's no guidance from FDA or CDC. So I would say talk to your medical person or talk to the pharmacist locally who's giving vaccines. It does appear that you could do that safely to be able to get the second vaccine. But again, not recommended yet by FDA or CDC. So if that was done, it would not be along full guidance around the emergency use authorization.
All right, thanks, Paul. Next to Veronica Obey with WDTV.
Thank you. Good afternoon. To kind of switch off from COVID here, Governor, I just wanted to hear a little bit from you as far as the decision that was made by Judge Joseph Goodwin in regard to the preliminary injunction that's involving transgender athletes. If you can talk a little bit about that, I would appreciate it. Thank you.
Well, I can. I think what we're going to see play out here is this is just what our court system does. I mean, there's many more steps, and the case will still be ongoing, and I'm sure that the Attorney General is continuing to fight this case, and so it'll go on. It'll go on for a period of time. I want to make sure everyone understands my position wholeheartedly. I've coached boys, I've coached girls. I see how the fact that, for a long time before Title IX and everything, our girls were surely significantly disadvantaged. I see the fact that, I watch boys, I watch girls and everything. I see how they compete. I mean, we don't play girls teams against boys teams through the course of the year and everything. And all I'm saying is, I think myself, my personal feelings are it really disadvantages our girls. And so from that standpoint and that standpoint alone, that's my whole feeling. You know, from the standpoint of welcoming and embracing and loving one another, for crying out loud, we should always do that. We should always do that. No matter what our beliefs, that's what we should be doing. But in this situation, with the court situation, it's early in the game, and there'll be lots and lots and lots of stuff that'll go on. And so that, you know, my feelings are, you know how Jim Justice feels. Jim Justice feels that it disadvantages the girls. And really, I think that's the end of the story from how Jim Justice feels. From the standpoint of how Jim Justice feels about being all-encompassing and loving for everyone, I'm there. I'm there wholeheartedly, and that's how we all should feel all the time. But I think as far as this court case, it's going to go on for a goodly amount of time, and we need to let that play out and be respectful of Judge Chambers, be respectful of everybody, because you know, that's you know, no matter where it may be, you know, if it's you know, it may have been it was Judge Goodwin, you know. Okay, I mean, is that right? Okay, well, then I misspoke on that, but nevertheless, you know, I think be respectful of the process and be respectful of the decisions, and embrace the decisions, and embrace all the folks. But remember one thing: we should be all encompassing and all loving all the time. That's all there is to it. We should be that. Maybe we have different views, but in my view, in this situation, my different view is that I do believe it disadvantages the girls.
All right, thank you, Veronica. Next to Brad McElhenney with West Virginia Metro News.
Hi, Governor. Hi, everybody. Governor, you spoke last week about naming your former senior advisor to the WVU Board of Governors. That body, the Board of Governors, also has the chief operating officer for the Greenbrier serving on the board. Meanwhile, to the south, Marshall has started its presidential search. I wonder, what is your philosophy about how much sway the governor should have on university affairs? Thank you.
Well, Brad, I think this has been in place for a long, long time. And people come to me and you know, with recommendations and everything, you know, to the boards, and you know, wherever they may be. I don't talk to these people about what's going on. I don't think I've ever had a conversation, you know, period, with hardly anyone, you know, that you know, that's on a board, that, you know, that things are going on within the university. I let them completely, you know, operate on their own, and I'm not a player in that. As far as recommending good people and everything, you know, the only thing I would say, Brad, is just this: is if what you're insinuating is that you know, I've created, you know, I've put a person on the board that you know, and Elmer Capulse, you know, does a wonderful job, you know, as far as it being a good business person, you know, whether he was at Glade Springs or he's at the Greenbrier or whatever it may be. I think he's a great choice. You know, I think, you know, President Gee, and I think he's doing a great job, and I try to appoint the right people. I try to appoint good people and everything, good people that I feel like that are honest and everything. And naturally, I would, you know, I would know someone like that better than just somebody that's out on the street. Now, you know, from the standpoint of doing anything, if you're, you know, insinuating in any way that I'm doing something to gain an advantage, then shame on you. That's all I'd say. Shame on you, because I'm not going to do that. I'm never going to do that. I'm never going to do that, period. I've said everybody, and I've said to everybody, and I say it with great pride, absolutely, I don't want anything. And the sooner you learn that, the better off we'll all be. But from the standpoint of appointing, you know, I think Bray Carey will do a fabulous job. And Bray is a guy that's just, you know, just hungry for knowledge and hungry for work, and just works all the time and everything. And you know, I thought he did a great job here with us. And you know, and now, you know, he's wanting to do things in the private sector, and he's wanting to move on and everything. And both those individuals are crazy in love with WVU. And that's what you really need. You really, really just need that. So we want to, we want to continue to, to put good people on our boards and do it as fairly as we possibly can. And I guess that's one of the responsibilities of the governor. And, Rebecca Blaine does a fabulous job. Missy does a fabulous job on all these boards and bringing me recommendations all the time. And they vet them. My goodness gracious, the work that goes in before you can make a recommendation is pretty extensive.
All right, thanks, Brad. Governor, back to you.
Okay, we've talked about a lot of stuff today, and I hope everyone's paid close attention. To me, a humbling moment was Logan Fluharty, in Peyton City, and to see the great turnout of that community in support of a young man that's having a tough go of it. And I want you to keep him and his mom and all of his family in your prayers. Please do. Please, please do. And also keep in your prayers all the folks in that great city. Small town USA, small town West Virginia, and absolutely great, great, great people. Now, we've talked about, whether it be board appointments or whatever it may be. And I welcome everybody to ask anything they want to ask, and I try as hard as I can to never dodge any question. But the most important thing of the day, is just this, is the look on the face of Dr. Clay Marsh. That's the most important thing. I hope to goodness if you're watching the briefing, you watched really closely. I've said it over and over, he's a good man, and he's a smart man, and he's a doctor. And absolutely, the look on his face is concern. Not alarm, but concern. You got to really pick up on that. Because if he's concerned and you trust him like I know you do, then you've got to be concerned. And he's concerned for your kids. He's concerned for you. He's concerned for your grandmas or granddads. He's concerned. And he's concerned about this Delta variant because that's his primary job, to be concerned. Before absolutely the house is totally burning down and then walk out and say, oh, we got a fire. That's not Clay Marsh. Clay Marsh is telling us point blank, today is the day to be making decisions about getting vaccinated. We better listen. We better listen. Thanks, everybody. Thank everybody, all the media, all the folks, all the medical, all the experts, all West Virginians. We have absolutely continued to be together. We have different opinions, but we've stayed together, and that's what's made us strong. That's what got us through this and everything, and that's what's going to continue to get us through this. Be respectful, have different views, but stay together. God bless all of you. Thank you so much.